Hi, I'm Dr. Amy Brenner, and I've been practicing gynecology in the Cincinnati area for over 15 years. And during that time, a lot of women have come to see me with reports of vulvar or vaginal atrophy. And those symptoms present itself as burning or pain or bleeding with intercourse. I also have heard a lot of women report symptoms of leaky bladders or leaking urine when you just don't want it to. In addition, I've also heard a lot of women report uh, symptoms of sexual dysfunction. One of which is it takes a little longer to have an orgasm, orgasms weren't what they should be, or just sex in general just doesn't feel like it used to feel. Sometimes when couples have intercourse, it just wasn't like it was when they were younger. And I call this term, or this term has been referred to as genital mismatch. And what this means is as a woman goes through the aging process and may have had children, as a man loses girth or size of the penis, which naturally occurs with age, what was once a good fit when the couple was younger, it may not be as good of a fit now that the couple is older. And therefore, just sexual intercourse isn't as pleasurable as it once was. Up until this time, we certainly had options to treat symptoms of vaginal and vulvar atrophy, such as topical estrogen creams, but there are some women that just don't respond to topical estrogen creams, about 20% to be specific. In addition, there are also just some women who don't want to use a topical estrogen, either because of the mess associated with it, the inconvenience associated with it, or just the risks associated with estrogen therapy. Many women actually cannot use estrogen therapy, such as contraindications, such as breast cancer. For urinary incontinence, certainly we have many options in our tool chest to treat urinary incontinence, such as mesh sling for stress incontinence, medications to treat overactive bladder and urinary frequency. But the medications certainly have its own set of side effects, such as constipation and dry mouth and dry eyes. I speak to a lot of women about the other options for urinary incontinence, such as pelvic floor physical therapy, Botox in the bladder, and even InterStim. And for certain patients, this is a great option. Unfortunately, with all of the traditional therapies, though, associated, there are associated side effects and or complications. So up until recently, those are the things that we've had to offer our patients. The O shot is certainly a great non-invasive treatment for both vaginal and vulvar atrophy as well as urinary incontinence. And now that we have the Intima, or what we like to call the LEO, or laser enhanced O shot, we can combine both of these procedures together for an even enhanced effect for the treatment of vulvar vaginal atrophy as well as urinary incontinence. Women who are just wanting to treat the genital mismatch or the vaginal laxity aspect of their reproductive organs, then certainly the Intima is the procedure that is needed. Up until this point, there really hasn't been a lot to offer women who are experiencing vaginal atrophy or as a couple genital mismatch. Certainly surgical options can be performed, such as labiaplasty, or male enhancing procedures such as using a penile pump or even the Priapus or P-shot. But having the Intima is a great addition or a great tool to offer my patients that actually treats all three of those areas: atrophy or dryness, urinary incontinence, as well as vaginal laxity. The Intima can also be used to treat the external vulva or the skin around the vagina. Just like all the skin elsewhere on our body, as we age, the tautness or the tightness of the tissue starts to decline. So this also happens in the vulva. So women who are looking for a more youthful appearance of their vulva can also elect to have the Intima performed on the external vulva. We certainly apply numbing cream when we use the Intima to the external vulva. How it works is it works similar to having a fractional CO2 of the face. When we treat the face with a fractional CO2, what it does is it delivers a controlled beam of laser energy that in a controlled way selectively targets the tissue. And then over time, during the body's natural healing process, more collagen and elastin is formed, therefore creating a more tightness to the vaginal and vulvar tissues. We would be happy to discuss this in more detail with you in a complimentary consultation. So I encourage you to call our office at 770-0787.